Hello, today we are going to talk about the topic endotracheal sectioning. Okay, we know some patients have the artificial airway. Okay, with that artificial airway, the person is not able to cough. Okay, so if there is any secretion from the trachea, okay, any secretion is present in the trachea should be uh, come out by this normally come out by the aspiration technique. Okay, so but for those person who are having the artificial airway, we are doing the suctioning. Okay, the extra secretion is all come by the suctioning. Okay, they not able to cough. Okay, there is no cough, so here the suctioning is happening. So that is the endotracheal suctioning. Okay, we can tell it is a process of removal of the secretion from the tracheobronchial tree through an endotracheal tube with the help of the mechanical suction device. Okay, so that is a endotracheal suction. Okay, so what is the purpose of this? Why we have to do this? The first purpose is to remove the secretion. Okay, and to prevent the infection. Okay, lower respiratory tract infection. Okay, so the secretion may lead to the infection. Okay, and to provide the effective ventilation, if the secretion is there, the some airway block may be happen, so that effective ventilation is not occur. For that we are giving, and to stimulate the coughing, for that we are giving. Okay, for whom we are giving the endotracheal sectioning, it has two type of indications. First, there is therapeutic indications and diagnostic indications. Okay, first that is a therapeutic indication. Let's discuss about it. If the person having the noisy breathing, okay, in the ventilator or without the ventilator, and visible secretion in the airway. Okay, when we look into the nose, we can notice something is there like that. Okay, and there is a decreased SpO2 in the pulse oximeter. Okay, and the person unable to generate the cough. Okay, they can't produce the cough. And some of the condition like pulmonary atelectasis. Okay, so for these conditions are associated with the secretion retention. Okay, and some of the procedures like a bronchoscopy, if we are going to do the bronchoscopy, we can, if there are any secretion that is blocking, then we can do the endotracheal suctioning and the endoscopy. So for this procedure we are doing this. Okay, then come to diagnostic. Okay, when we take the sputum specimen, okay, for investigation, so we can use it. Okay, if the person is bedridden, they can't able to breathe and can't able to produce cough, but we need their sputum, then we can do the sputum suctioning. Okay, that is a sputum specimen is obtained by the procedure. Okay, then come to the complication. If in during this procedure endotracheal suctioning, what are all the complications may be there? Okay, hypoxia. Okay, or any trauma, any injury to the tracheal or bronchial mucosa. Okay, any area, and mucosa is the first layer. Okay, then cardiac arrest or respiratory arrest. So if it happen, we should immediately start the CPR and artificial respiration. And some people, there may be a bleeding, pulmonary hemorrhage or any bleeding may be occur, and cardiac dysarrhythmia, rhythm. Okay, so the rhythm of the heart may be changed. Okay, and as I already told one condition, that is the atelectasis. So that condition may be arise after the procedure, and bronchospasm may be happen. For some people, high BP or low BP may be occur, that is a hypertension or the hypotension may be occur. And intra and one complication, intracranial pressure may be increased. Okay, so these are all the complications. Okay, then come to the types of the endotracheal suctioning. We have two types of suctioning, that is a open suction and a closed suction. Then come to the procedure. Okay, so for the endotracheal suctioning, we first do the assessment of the client. Okay, then preparing the patient and the equipment and implement the procedure, and we have to evaluate it is functional or not, like that. So what are all the assessments we have to do? Breathe sound, notice the breathe sounds and difficulties in that, and oxygen saturation level. Then respiratory rate and pattern of the respiration, and we have to focus on the hemodynamic parameter, that is pulse rate, blood pressure. So that is, these are all the hemodynamic parameters. So these, and the cuff effort, okay, and ICP, intracranial pressure, sputum characters like the color of the sputum, volume of the sputum, consistency of the sputum, model of the sputum. So these like sputum characteristics. Okay, and the ventilator parameter, that is a vital capacity. Okay, so these like pressure of the inspiratory pressure and volume, tidal volume, like that. So these like components we have to notice in the ventilator parameters. So after these, also assess the depth and the rate of the perception. Okay, during depth, what is the auscultation, what is the sound of the heart, like that we have to note. And we have to assess the wheezing. Okay, and the rattle sounds in the chest. So this like we have to notice. Also patient preparation, we have to explain the procedure to the patient. If the person is conscious, okay, then patient should be receive the hyperoxygenation. Okay, hyperoxygenation, that is a delivery of 100% oxygen. Okay, the SpO2 level should be 100% for 30 seconds. Okay, uh, before, அதாவது we have to give the oxygen before 30 seconds to the suctioning. Okay, so the suctioning is done after 30 seconds, then we have to give the hyperoxygenation for first 30 seconds, then do the procedure. And the position of the patient should be the supine, and we have to isolate the breath sounds. Okay, and we have to if the patient is conscious, we have to tell the importance of the cuffing. Okay, and during procedure we have to assemble the equipments. Okay, equipments like for auscultation, stethoscope, vacuum source, okay, that is a jar. Okay, and gloves, sterile suction catheter, and our goggles for our protection, apron, mask, and sterile normal saline in this, and ambo bag. Okay, so these are all we have to carry. Then to the suction tube. Okay, that is a suction catheter is is selected according to the size of the ET tube, endotracheal tube. Okay, then during the implementation we should hand wash first. Come to the implementation. First we should do the hand wash. Okay, it reduces the transmission of the microorganism, and we should wear the protection for our, okay, goggles, mask, apron. Okay, and open the end of the suction catheter. Okay, and connect it to the suction tubing. Okay, and wear sterile gloves. Okay, after gloves wearing, with the help of the assistant, open the suction catheter package and connect it to a suction tube. And we should ask the one assistant to disconnect the ventilator. Okay, and then kink the suction tube and insert the catheter into the ET tube until the resistance is felt. If the resistance is felt, so there is something in the something blocked in that area. Okay, so if the resistance is felt, then we should take back 2 centimeter again outside. Then we should apply the suction. During suction we should rotate the suction catheter so that it can suck in all direction. Okay, Okay, the suction duration should be 10 to 50 seconds. Okay, then if the suction is completed, then we have to give the ventilator. If there is any problem during the process, means we can give the amber bag, or during that time we have to give the ventilation and all. Okay, so after a procedure we have to discard all the equipment, okay, and wash the hands, okay, and we have to flush the suction tube with hot water. Okay, so these are all we have to do. Okay, after procedure we have to ventilate the patient. Okay, again, and we have to give the oxygen source to the patient. Okay, and we have to document properly. Okay, if the nurses are there, they have to document. And it is not a routine process. Okay, it is when it is necessary. If there is any bedridden condition, we should monitor 2 hours once. Is there any blocking, any secretion is there? Okay, like that we have to notice. Okay, it is a harmful procedure. So if we do small mistake, it also leads to the greater problem. Okay guys, thanks for watching. In this video we just discussed about the endotracheal sectioning. I also having cough. Okay, thanks for watching. Tata.